If you think you have Lyme carditis, heart involvement with Lyme disease, don't mess around. See your doctor. And in this video, I'm going to give you some helpful information to make sure that you get the treatment that you need. Hello, I'm Dr. Bill Rawls. Question: what is the best treatment for Lyme carditis? This is one that hits close to home because when I had Lyme disease, that was one of my most pronounced symptoms. Symptoms that come with it, it's heart beating irregularly, skipped beats. My heart was beating about every second or third beat. Something called heart block, where your heart drops down to a rate of about 50 or 60, and even with exercise you can't bring it up, so there's a lot of exercise intolerance. Chest pain, just chest discomfort, not failure to thrive, not being able to do the things that you want to do because basically the heart muscle is being invaded by microbes and is inflamed. I think most everyone with Lyme disease gets a little bit of this because when the microbes enter the body, they infect white blood cells and they're distributed throughout all tissues in the body. What they want is collagen. And so high collagen areas are brain, joints, muscles, and especially heart muscle. So it is something that's pretty darn common. In a significant degree, it's not something to mess around with. So if you're having significant cardiac symptoms, and here I'm talking about not just a skip beat every now and then, but a real irregularity or chest pain, or your heart rate just being at a really low rate, you need to see a doctor. You need to be evaluated. One of the first things they're going to do is an EKG. That's where they did that on me, and they showed that I wasn't having acute loss of oxygen or hypoxia to my heart, but it was chronically. My heart muscle wasn't getting what it needed just because the whole heart was irritated. And that can lead to a variety of tests that can include a cardiac catheterization, which I did have. And there they're looking at two things. They're looking at the ability of the heart to beat. Is the muscle swollen? But also, is the heart getting blood flow through the coronary vessels? In my case, my heart was not significantly enlarged, and my coronary vessels were clear. I didn't have any plaque formation. In other words, I didn't have atherosclerosis going along with the infection. Classically, the treatment for that is antibiotic therapy. So if you've got significant heart involvement, that is an indication to do antibiotic therapy. You can do it either oral or intravenously, depending on your doctor's choice. There are various options for both. And that often will help resolve the symptoms, but not always. It didn't in my case. The antibiotics didn't help that much. I continued having symptoms, and it wasn't until I embraced herbal therapy and really took a high concentration of a variety of herbs with antimicrobial properties that over a several year period, my heart gradually came back to normal. But it took time. It took several years. I finally got full capacity back. I may still have some scarring in the heart muscle. It's hard to know, but at this point, I have full capacity to do whatever I want. So first off, you need to see your doctor. You need to be evaluated if you've got significant cardiac symptoms. Do everything they tell you to do. There probably will be drugs like beta blockers to help normalize the rhythm. And if antibiotics are recommended, I would suggest taking them. Make sure that if you think you have Lyme disease and you haven't been formally diagnosed, keep pursuing that option because they're not going to give you antibiotics until they define that you absolutely have Lyme disease. So keep pushing at it, and sometimes that's what it takes to get the therapy that you need. But if antibiotics don't get you where you need, and doing course after course and after course of antibiotics tends not to work because you end up destroying the normal flora in your body and disrupting your immune system functions, which are essential for getting well. So if the antibiotics aren't getting you there, or in addition to antibiotics, do the herbal therapy, do intense herbal therapy. There's so many great herbs that help normalize cardiac function. Many of the ones that we use for Lyme disease, like andrographis, is really nice. Reishi mushrooms, all of these have some really helpful properties. I took an herb called hawthorn, about 1,200 milligrams a day, that helped balance cardiac function. I was also taking about 200 to 400 milligrams of coenzyme Q10 at that point, because coenzyme Q10 has been found to be beneficial for heart failure. So those are some basic things to do in addition to following the recommendations of your physician if you have been diagnosed with Lyme carditis. So if you want more information, please check out my website, rawlsmd.com. Lots of great information about Lyme carditis and a lot of other topics there. Please sign up for the newsletter so you can keep this information coming to you to help forward your recovery. Take care and be well. Thanks for watching this video. Please take the time to leave a comment below, and while you're there, ask me any questions, or if you have topics that you'd like to hear about, pass those along. And please subscribe to my channel so you'll have these videos coming your way regularly. Thank you.